Sickle cell trait is a hereditary disease in which a person receives one sickle cell gene and one normal blood cell gene. Sickle cell trait is common amongst individuals who come from areas where malaria is widespread. It has been found that this trait occurs in 1 in 12 African Americans. Though not extremely common, this disease becomes of particular concern in athletics, as it is one of the 4 leading causes of death in non-traumatic athletic death. When working at high intensity levels, the red blood cells in an individual with sickle cell trait begin to sickle or take on the shape of a crescent moon. The cells no longer in their normal shape have a more difficult time flowing through the body. The cells essentially become sticky and can logjam, preventing oxygen-rich blood to make it to working tissues, causing muscles to go into exertional rhabdomyolysis, a medical emergency. A total of 7 athletic deaths in the past decade have been attributed to sickle cell trait.
Up to 13 college football players have died after a sickling collapse. Though more common in football, sickling collapse is not limited to football. The harder and faster athletes go, the earlier and greater the sickling. Sickling collapse is often mistaken for cardiac collapse or heat collapse. With sickling collapse, an athlete goes down with cramps. These cramps are less severe than heat cramps. The primary symptom of sickling collapse is extreme muscle weakness. The NCAA currently mandates that all athletes get screened for sickle cell trait. No sickle trait athlete is ever disqualified because simple precautions seem to suffice. Simple guidelines when dealing with sickle trait athletes should be followed. Encourage preseason strength and conditioning. However, athletes should be excluded from performance tests such as sprints. Ambient heat stress, dehydration, asthma, illness, and altitude predispose the athlete with sickle cell trait to an onset of crisis and physical exertion, so precaution must be used in these situations. Build up slowly with pace progressions and allow for longer recovery time. Allow the athlete to set his or her own pace. Cessation of activity with the onset of symptoms. Educate the athlete on the importance of reporting symptoms. If a collapse occurs, treat as a medical emergency.